This week we're talking about identifying shoulder dislocations and their severity, but first, our disclaimer. Mike Matthews, physical therapist here with the PT411. Thanks for joining me. If you already haven't done so, make sure to check me out on Facebook, YouTube, Instagram, TikTok, and Twitter. Subscribe, turn on notifications. Also, make sure to check out thept411.com. So, the shoulder dislocation, not to be confused with the shoulder separation, which we will get to in the next few weeks. What is this dislocation? It's basically when the ball and the socket joint dislodge, the humerus in the ball gets pushed out of the scapula, the socket there, or the shoulder blade. Most of the time, this happens when it's being pushed forward, but it can dislocate several different ways. Now, this can be caused by a number of different things, usually some sort of traumatic accident or sports injury, something along those lines. Now, an easy sign to see if there may be a dislocation, move the arm across the body, see if that's difficult to try to touch the other shoulder. Now, if you can't do this after a traumatic injury, you might want to go and get that shoulder checked out a little bit further to see the severity of a dislocation. After it gets reduced, a clinician may need to do the apprehension test, where we put the arm out to the side with our elbow bent. We're going to rotate the arm up this way. We're going to try to glide the humerus going forward this way. We're looking to see if it causes you some apprehension or if it causes pain. Now, if this test is positive after several weeks, there's a decent chance you might need some sort of surgery. Now, the younger you are when this happens, the more likely it is for this dislocation to reoccur, to happen again. Under the age of 10, you are nearly guaranteed for this to happen again. As we get older, less likely that it's going to reoccur. Two things factor into this as we get older. Things tighten up and calcify over, and when we're younger, things are much more mobile. Also, the younger we are, usually the more active we are. So when we dislocate earlier in life, we're going to be trying to bounce back, get back into activity much sooner when we're more prone to re-injury. Later in life, we don't have as many physical endeavors to bounce right back into. Also, under the age of 10, you have just shy of 100% chance of that re-injury. Getting up past the age of 60, that chance goes way down to 20%. So, we see people in the mid 40s and under usually require some sort of surgical intervention. That's usually the preferred treatment after the dislocation. Also, if you've had several dislocations over a short period of time, well, surgery is probably your best option in that scenario as well. Now, there are several different tears and lesions that can result from this dislocation. We have the labrum. That's the cushion that's found between the ball and socket and that joint there, so that can get injured, that can get torn. We can see specific injuries like the Hill-Sachs lesion, the Bankart lesion, and since the long head of the bicep attaches to the labrum as well, we can see injuries and tears to that tendon. And at times, the rotator cuff can be injured, that set of four muscles that provide stability to that joint. And also, we can get fractures to either one or both of those bones since it is following a traumatic episode. Now, we'll be looking at what to expect after surgeries to correct all those different types of injuries in later videos. With these dislocations, we end up losing a lot of stability to the shoulder complex. In the next video, we'll be looking at strategies to increase that stability. So make sure, stay tuned. Again, I'm Mike Matthews, physical therapist with the PT411. Thanks for joining me.